Good day, everyone. Today I will present a case report which was published in JOE in 2024. This case report details an unusual instance of periapical cyst lined with respiratory epithelium and characterized by rich nociceptor innervation expressing the LPS receptor, which is toll-like receptor 4. So it is a 22-year-old Caucasian female presented with constant severe pain, reported as 10 out of 10 in tooth number 15, and she reported that cold elevated her symptoms. Clinical examination revealed no extraoral or intraoral swelling, but noted lymphadenopathy in the left cervical lymph nodes, erythematous and tender oral mucosa at the apical region of tooth number 15, slight extrusion and class 1 mobility. The tooth did not respond to cold or ABT, but was tender to percussion and palpation. Radiographic evaluation showed a large 10 mm diameter radiolucency surrounding the ABCs of tooth number 15. And so the diagnosis was pulp necrosis with symptomatic apical periodontitis. Non-surgical root canal treatment was planned and performed in tooth number 15, revealing copious purulent exudate from the canals. Intracanal calcium hydroxide paste was placed, followed by temporary filling, and amoxicillin was prescribed due to systemic involvement of infection. 2 weeks later, the patient was asymptomatic and the root canal treatment was completed. 4 months after initial therapy, the patient reported increasing symptoms for 10 days with constant dull ache increasing with biting. Radiographic evaluation showed a reduction in the periradicular lesion size despite persistent symptoms, and a CBCT revealed a large, well-circumscribed lesion near the left maxillary sinus floor, without radiographic evidence of sinus floor discontinuity. Treatment options were discussed with the patient, and a clinical decision was made to proceed with intentional replantation of tooth number 15. And after careful extraction, the socket was irrigated and curetted, yielding a large, well-defined lesion in tutu. The patient reported pain during tissue curettage despite adequate anesthesia. Approximately 1/4 of the lesion was submitted for histological diagnosis, and the remainder was processed for laser confocal immunohistological evaluation. The tooth then was replanted after resection of the apical 3 mm, debride and filled with MTA. There was mild postoperative pain that resolved within 24 hours, and at 7 days follow-up for suture removal, the tooth had mobility class 2. At the 1-year follow-up, the tooth was asymptomatic with normal occlusion, no signs of ankylosis or abnormal mobility, no percussion or palpation sensitivity, normal periodontal propping, and normal radiographic appearance. For the results, the pathology report showed that serial sections revealed a cystic structure lined by pseudostratified ciliated columnar epithelium and adjacent well-vascularized connective tissue. The diagnosis was periapical cyst. And for the immunohistochemistry, the cystic lesion was densely innervated with nerve fibers localized around the periphery of the cystic lining. The LPS receptor, which is toll-like receptor 4, was broadly expressed in cells within the lesion and by the peripheral innervation of the cyst. So this case represents the first reported instance of innervation within a periapical cyst in human biopsies. The epithelial lining was composed of pseudostratified ciliated respiratory cells, which is a rare finding in periapical lesions. Reported incidence in the literature varies between 0.8 to 2% only. While typically originating from nasal cavity or maxillary sinuses, the CBCT initially showed no direct communication with the maxillary sinus, although prior osteoclastic activity might have allowed migration of ciliated epithelium. The dense innervation of the cyst, particularly with LPS-sensitive toll-like receptor 4 expressing nociceptors, suggests their involvement in the patient's spontaneous and mechanical allodynia. The immediate pain relief after cyst enucleation and the pain experienced during curettage, despite adequate anesthesia, further support the role of this increased innervation density in the patient's symptoms and possibly in the failure of local anesthesia. And thank you.